Hello, everyone. How are you guys doing? Welcome to another case review. Oh my gosh, I forgot to get the presentation. I've been getting the bingo ready. I put on the comments right here for you guys the link for the bingo card. So if you are new or if you have been here before and you like to play bingo with us, check it out on the bottom. Let me pull up the presentation. I totally forgot about it. Oh my gosh, I need to log in. Let's see. I think it's this one. Welcome. We're doing another case review today. I'm going to try to do 2 of them. Continue. I just have to open my presentation because I totally forgot I was presenting something. And guess what? It's telling me it's not the right login. I literally just spent 48 minutes trying to find out what my passwords were. Anybody else can relate. Okay, right here, case studies. I have them pulled up. Do you guys remember where I stopped last time? I think I'm going to start in the beginning and then kind of, let me turn this off. All right, tell me, where are you from? Who is, let me go on Instagram. I'm also going to go live on Instagram. There's something special, guys. Oh my gosh, I'm going to freak out. Go on Instagram. No, stay here. On Instagram now, it is, let me turn my volume off and I'll show you guys how it looks. They just added this new feature on Instagram that it shows portrait. Let's see if it's going to show up for me. Yes, look, it's portrait. Oh, this is pretty cool. Very, very good. All right, let me put it here. Oh, why is it showing 2 of me? Maybe it's showing me on Instagram. Do you guys see 1 of me or 2 of me? Because I see 2 of me. Anyways, you guys keep messaging me. Hello from India. Yes. I'll be in India in February for the International Association of Sleep Surgery. All right. Share my screen. Image, share screen. Google, yes, window, entire screen. Let's do entire screen 2. Do you guys see that? Also share audio, system audio. I think this is going to work, y'all. Pro tip, be careful sharing audio if you have a guest. They will hear themselves. Okay. All right, here we go. So we did a little bit of case studies last time. And I was just like, oh my gosh, we have to do case studies again. So the way that we do this, if you're new here, we do a little live to talk about anything myofunctional therapy that may be interesting to you guys, and then to invite you to join our course, which starts January 1st. And then we have fun. So we do bingo. I put in the link right here in all of the platforms that we're going live on, the link for our bingo. So it's going to be a myofunctional therapy bingo card. And as soon as you get 1 full line, you have to take a photo and email to connect@airwaycircle.com. Take a photo and email, and you will get a cup for free or a t-shirt for free if you get a line. If you get the whole board, and you have to take a photo and send. Last time we had somebody who did a whole board, but there was a word that I didn't say. So very important for you guys to keep up with the words. Of course, everybody's card is going to be slightly different. It generates for you. But if you get the whole card, you get 50% off the foundations course. If you have taken 1 course, 2 courses, 3 courses in myofunctional therapy, I promise you there's still so much that you're going to learn from foundations. It is totally different than anything else that you see out there. We have our manual that nobody else has. We have our study club on WhatsApp that nobody else has. We have 4 extra meetings after the course is over. We have tons of live meetings, tons of recorded content. Anyways, You guys are going to absolutely love it. So I would love for, if you haven't taken foundations yet, for you to join us. And then in August, we have Myo Circle. Why is that showing up there? There he goes. Next August, we have Myo Circle, which is our advanced myofunctional therapy course. That course is the why behind the exercises. So again, if you have taken several courses and you still do not understand the why behind exercises, you have to take foundations first and then come back and take Myo Circle. They go hand in hand. We all know that myofunctional therapy training is not standardized. Everybody teaches a little bit of what they know, so everybody holds a piece of the puzzle in this field. We all know that one course is not enough. That's why we created really a whole year of courses. If you take all of the courses that Airway Circle offers you, it's a whole year of program. So we have foundations, that's in January. Then we have MyoBiz, which is on demand only right now. Myofunctional therapy business course. So any business questions, go there. And then Myo Circle is the advanced one. And the Myo Circle now is 16 weeks. And foundations is 12 weeks plus 4 months. Anyways, I know that what we offer is absolutely incredible, very different than anything else you're going to find out there. Let's start. Myofunctional therapy, case studies. You guys know me. My name is Renata Nami. I'm originally from Brazil, registered dental hygienist since 2010, no longer practice clinically. I started Myo in 2016. I run and operate Myo Moves, and I am the founder of Airway Circle. There's my beautiful family. And you know what? I was looking at my face today. We just did our Christmas pictures, and this day right here is whenever we did our Christmas pictures 2 years ago. So this was before I had palatal expansion done. And I do like the way that I look more now. However, I was looking at my photos. Is it because I'm older, maybe? I feel like I look old. Oh my gosh. And I see some other people getting palatal expansion, like Marpy done. You guys tell me if I'm crazy. And I'm going, oh my gosh, they're not looking right. Is it the same with me? Please tell me. But yeah, I look so young. My skin was great. My hair was great. Oh my gosh, can we go back in time? All right. We talked about case 1 last time. This 12-year-old girl, what would we do? So I'm just going to go through it. Nasal sprays. Let's clean our nose. We talked about this little girl being one, not even a session, and she already started breathing through her nose, looking so different. And at the end of therapy, her bite completely changed. This little boy, I did talk about him already, taking melatonin every night, wetting the bed every night, taking a whole hour to fall asleep and waking up throughout the night, all gone in 4 sessions. Did I go through these exercises? You guys, whoever was here last time, remind me, talk to me right here in the chat. I am listening to you. Let me take a quick look on Instagram. Oh, I don't think Instagram can see my screen. You guys tell me. Oh yeah, they can see my screen. And they can see my screen really good. Okay, awesome. All right, you guys tell me if I went through these exercises, what they're for. Did I do this already? Tongue ties? I don't know where I stopped last time. Can you guys hear me? Because nobody's answering me. Can you guys hear me? Hello. Please tell me if I did this. This is what myofunctional therapy only did for this patient. So we did about, I think it's 4-6 sessions before he got a release done. But this is the importance of having myofunctional therapy before you get your tongue tie release. We are teaching those muscles how to move, how to contract, how to reach, all of these things. Yeah, I cannot see any of your comments. Bradley from Ontario, Rachel, Nikki, Elizabeth. You guys say hi to me again over here in the comments to see if I can see your comment come through. So transverse maxillary deficiency predicts increased upper airway collapsibility during drug-induced endoscopy. What is this? Okay, I can hear you. Somebody said, thank you, Gemma. It's right, Gemma. Hey, okay. Okay, you guys are awesome. You're up to case 2, 62-year-old woman. I didn't go over the exercises. I can. Okay, you can attend last session. We do have last session recorded, and this is also going to be recorded. So even though anybody cannot stay the whole time, we cannot be here live. But everybody, if you have your bingo card, please say bingo right now. I want everybody to have their bingo cards because it is so much fun, and I love to give prizes away. So make sure you do bingo card if you have your bingo card. If you need me to put the link in here again, it should be in the comments of anything. Let's see if this is it. Is that the bingo card? Oh, I don't know what I just posted. Oh, no, that is not the bingo card, y'all. Oh, my gosh. Okay, see, I cannot do two things at once. Sorry about that. That is not the bingo card. I uploaded it in the top. If anybody can copy and paste again, I'll be very appreciative because Renata needs to focus over here. Okay. So this research was done by Dr. Thuler, measuring the roof of the mouth like we're measuring Zoe right there with a caliper. And if the measurement is too narrow, it increases the chance of them collapsing, the airway collapsing at night. Okay. Here's Zoe, how we measure. I don't remember if I did any of this last time. I feel like we ran out of time. So you grab the caliper, you use the small arms of the caliper, not the big ones, and you go from molar to molar. Zoe's wearing an alpha appliance there. But you're not really touching the molars. You're going a little bit higher onto the gums. I want to kind of poke the gums a little bit. And then I open all the way, but still on the gums. See how I'm not on the teeth? Ta-da, that's a 34. Or you can use a cotton roll. The cotton roll is about 36 to 37 millimeters. Thank you, Anne. 36 to 37 millimeters. And that will give you a good idea of, there it is. I can put on the screen. I didn't know that. We talked about types of palatal expander. I think we already went through all of this. All right, let's see the next case study. Here, is that it? Yeah, 62-year-old woman with an AHI of 24, which is actually moderate. OSA, all of our posts said mild. And one person caught it and sent me a message. So thank you guys. That was on purpose to see if everybody was paying attention. So this 62-year-old woman has an AHI of 24, which is almost severe. Severe is 30 or more. She has a BMI of 28.1. She has hypertension. Her main complaints are swallowing difficulties and neck discomfort. Normal ENT exam, pending CPAP initiation. Now, question is, do you release the tongue tie or not? What do you guys think? Keep up with your bingos. Hopefully you have your bingo cards so you can get some free prizes. Do all tongue ties need to be released is my first question. The answer is no. Some tongue ties can actually not be released because it could be dangerous if somebody has some type of disorder or low tone or a different condition that could possibly cause more airway obstruction. Then the answer is no. Some people are fine. They say, I don't have any symptoms. I grew up fine. I don't really need anything like that done. We always have to go by the patient's symptoms and how that tongue tie is affecting function. In which cases would you advise not to operate a laryngofrenum? So it's pretty much what I was saying. If it's a patient with a specific condition where surgery is going to be difficult, or if it's somebody that they cannot numb or they cannot put to sleep. If it's a young child, a lot of ENTs will do tonsils and adenoids surgery and go ahead and get the tongue tie release. Sometimes, it's dangerous for the patient. Is there a critical age for intervention? The answer is the earlier, the better. I don't think there's a critical age because you can get your tongue tie released as an adult also. However, we know that if the tongue is restricted to the floor of the mouth, there are several things that are going to be impacted, including the facial growth, including their breathing, including their tongue position for initiation of speech and swallowing. There's just so much that could be related to it. So ideally, we would love for all the babies when they're born, like they do it in Brazil and how they're doing in Uruguay, for the babies to be checked in the hospital to see if they have a tongue tie and go ahead and getting them released ASAP. But at the same time, does every baby need to have their tongue ties released? I have a little cousin that was born, and he was born like this. Trouble breastfeeding, and everybody started showing me the photos. Renata, what do you think? And I, referred to a release provider and an IBCLC, or actually was a speech pathologist that took care of him. But they didn't release. And later come to find out that the baby has Down syndrome and autism. So I'm not sure if actually would have been a good idea to release that baby with such low tone. But that's why it's so important for us to work with different professionals, let them do what they do best, let everybody do their evaluation. That's why we cannot diagnose from a photo, and all of this. So let's see what else. Critical age, the earlier the better. But I think that a big question that we get is if a baby is nursing fine, gaining weight, mom doesn't have any pain, but they have a tongue tie, do you get it released? What do you guys think? Part of me is like, yes, go ahead and get it done. However, just that trauma in the mouth can create food aversion, breastfeeding aversion. It can create trauma. It can create so many other issues if the babies don't have any issues. Are there maybe some hidden things that are happening that we don't really know yet? Probably. Are we going to have issues with the crawling and walking? Maybe. Eating, chewing, swallowing. I don't know. Growth and development. So if a baby is not having any issues at all and they've been evaluated by different professionals in their areas, so let's say an IBCLC, a release provider, and it's always good to ask the mom. If the mom has a bad feeling, don't do it. I think that your sixth sense is so, so important when it comes to this. So anyways, after a couple of professionals have been consulted, I don't think they need to have a release if there's not a functional deficit. How long does it typically take to fully rehabilitate all orofacial functions in a patient like this? I wish it was an easy answer, right? Adults, so we're talking about a 62-year-old woman. Are we going to do the exercises daily? So in order for myofunctional therapy exercises to work, we do need to ask about frequency, intensity, and duration, just like sucking your thumb. How bad is it going to be? Depends on frequency, intensity, and duration. So the exercises are the same thing. How well are you going to gain muscle when you start going to the gym? It's going to depend on frequency, intensity, and duration. So the importance of taking a really good evaluation on a patient and understanding what you see and prescribing exercises that are very targeted for that patient is that if you do targeted therapy, you're going to get results faster. So that's the one why we're inviting you to take this course. But number two, because of course, if anybody sees an exercise on the internet and everybody repeats this exercise over and over and over, it's going to really benefit some people. Other people are not really going to, because that's not what they need. So there's a huge benefit of really, really prescribing things well. But how long is it going to take to rehabilitate this patient? So it depends on how well she's going to do the exercises. It's also going to depend on muscle tone. It's going to depend on if they eat red meat. Isn't that interesting? You really, really need red meat in order for things to work better. For the muscle to respond, muscle needs movement and it needs protein. But protein from red meat does something different to that type of those types of muscle fibers, and they respond way better. So I usually say for adults 3 to 4 months, for children 6 to 12 months. However, I work very differently than most myofunctional therapists out there. I take lots of breaks. I like to do phase 1 and phase 2 therapy, then take a big break and see them again for phase 3. What is phase 1? Phase 1 is whenever I work on a little bit of the course. I work on mobility, I work on awareness, I work on tongue position and nasal breathing. And then phase 2 is control and coordination, when I do the types of exercises that you're going to control your muscles and hold. So think about going to the gym and sitting on the wall or doing a plank. Those types of exercises that you're going to contract the muscle a little bit longer, they're going to give you more control, which means you're going to function better. You're going to move the tongue how you want it to move. Whatever you tell your brain, it's going to do it way better. Therefore, function works better. And then I usually do tongue-to release and palatal expansion and then they come back for phase 3, which is chewing and swallowing. So that is how we work. So I would say on an adult, depending if they're going to get a release or not, which in this patient, AHI of 24, BMI of 28, hypertension. Here is the key. She has swallowing difficulties and neck discomfort. Normal ENT exam was normal. So they're going to start her on a CPAP. So for real, what would I do? I would refer her to a speech pathologist. Why? Because she has swallowing difficulties and neck discomfort. I want to make sure that there is nothing medical here that I am missing, because I am fully into my myofunctional therapy brain. I'm looking at muscle function, muscle movement. I am going to check her swallowing, but I need to understand what kind of swallowing difficulty does she have. Is she choking while she's swallowing? Is the food going up to her nose? I don't know what it is, But if it's anything outside of my scope, I am not treating this patient. I am sending her to somebody who can actually take care of her exactly with whatever issue she's having. And neck discomfort, I also want to know, is there anything else going on here? Is it just pain? Did you sleep on the wrong side? Or is it something that's chronic that's been going on? Do we need to check thyroid? Do we need to check any, I don't know, sternocleidomastoid muscle? Does she need to go to a physical therapist? So I probably would not treat this patient. However, one of my big requirements here, my request would be to get a CBCT x-ray. I really want to see what's going on, because even with the difficulty swallowing, the neck discomfort, I want to know, what do I see there? And I also would be asking a lot of questions. When did this start? How long have you been in pain? Is the swallowing difficulties only when you drink solids? Only when you eat? Drink liquids, or only when you eat solids? Is it all day long, every single time you eat? Is it a different type of texture? And then, of course, based on all those things, I'll send her to a feeding therapist, and then or a speech pathologist that can take care of swallowing dysfunction. And then neck discomfort. Again, where is it at? How long has it been? Have they been in an accident? Have they had any trauma? Have they fallen? All of these things, so I can proper, choose the professional who's going to take better care of her. I think that's one of the most important things as a myofunctional therapist, is knowing your limitations. Know when it's time to refer the patient to somebody else. You don't have to fix everybody. You're not the person who's going to be able to fix everybody either. But the first step of being a really good clinician, a really good myofunctional therapist, is doing an amazing job with this evaluation, with this assessment, with history taking. So, and then documenting and being able to send your patients to the right professionals if you can't help them. What do you like to look for in the CBCT scan besides the airway? Oh my goodness, there's so much. Tonsils, adenoids, septum, turbinates, TMJ, you said that, hyoid bone position. Some people look at C1, C2, C3 if they can see it. Atlas, some people look at that. Oh my gosh, there's so much. Sinus cavity, asymmetries. You may be able to see polyps and other things that are wrong with the nose or the teeth. There's so much, so much that you can see on the CBCT. A soft palate, lingual tonsils, so much. Let's see what else. So I'd say adults to fully rehabilitate. After surgery, like if they have Palate surgery would be a little bit different. It would be longer. But a simple tongue tie release case on an adult, 3 to 4 months, if they do really good. And if rehabilitation is not achieved, is there a risk that the patient's condition, especially the OSA, could worsen? Yes, I mean, if the patient is collapsing because of a low tone issue, and myofunctional therapy is responsible for that, and even after we treated them, they're still not responding, we have to ask why. Why are they not responding? Is it because they've had nerve damage? Again, goes back to history. Let's ask about, have they had any trauma? Have they fallen? Car accidents? Anything like that? Because it could affect what if they have nerve damage and that's the reason why they are not responding. That needs to be addressed. They need a different professional. Which course goes in depth on CBCT? Is it foundations or the advanced? I think that we have the CBCT on both. And you can correct me if I'm wrong. Yasmin, please let me know, have you taken any other course yet? The reason why we started making foundations a requirement for MyoCircle was because so many people that were taking MyoCircle were asking questions about foundations that they should have known already. And they had already taken, usually people that take MyoCircle have already taken 3 or 4 courses. And they would, their mind would be blown when they take MyoCircle. Like, we've never learned anything like this way. It made them, such better therapists. It kind of brings everything together, MyoCircle. So if you've only taken 1 course and you want to take MyoCircle, you still may be a little lost, and you want to go back and take foundations. Foundations is not like any intro course out there. It is totally different. I go on the basics of MyoCircle in foundation. So I'm already teaching you guys my protocol. I'm already teaching you guys how to prescribe exercises different and making you guys think about how to prescribe instead of giving you a list. I don't give you a list and say, do this one first, this one second, this one third, pretty much. Yes, I think this question was asked last time, and we have module on CBCTs and foundations and MyoCircle. Yes, I thought so too. Yes, very, very important. I mean, we talk about so much more stuff than other courses are not talking about. Reflex, integration, sensory processing. What else do you have to? Emotional trauma. People are not talking about this stuff. Gut health. Oh my gosh, I meant to do the slides at the end that I haven't had time today. I was running like crazy. I wanted to show you guys who the new mentors are. So every time that we teach our courses, Anne and I have been with Airway Circle forever. So we are usually always there as your mentors. But then we have new mentors that come in and out in each separate cohort. And I am so excited for this January cohort because we have a brand new mentor that was actually one of the OGs from Airway Circle. If you remember Airway Circle, when I first started, she was with me. And she has gone out on her own, opened 3 different practices. She's extremely successful. And she's coming back to mentor foundations. So if you guys want to learn from anybody, Chelsea Madison is your girl. She's in Tennessee, and she has an incredible practice, Breathe Well. Oh my gosh, let me see if I can find her Instagram so I can give it to you guys. She is absolutely incredible. She takes care of many, many littles also that we don't. So she's going to have a lot more insight that I don't. Let me see if I can find it. It's Breathe Well Group. Where is she? Breathe Well Group. You guys let me know if you find her on Instagram. I'm not finding right now. But Chelsea Madison, look her up. She is absolutely incredible. And she is one of our mentors for foundations. We have Anne Blau, who is a speech pathologist. And if you want to know anything about research, that girl reads research all day. She is a genius. My gosh, Anne is brilliant. If you have the opportunity to sit down and learn from her, she's incredible. And then we have Alex Clinton, also from Canada. Alex, I'm going to call her the biological myofunctional therapist and dental hygienist. Her father is a dentist, and she's really into biological dentistry and looking at gut health and looking at all these things. So we have such an incredible team. It's not just me. It's such an incredible team to kind of, hold you guys through this course, help you through it, look at all of these different aspects that other courses just teach you, Myo, and a list of exercises. This is, like I said, nothing like you have ever taken. Let's see what else we have to show you guys here. Okay, so here's a question. Would you release this patient? Who can help me? This patient was sent to me for a tongue tie release. Would you release this patient? Yes or no? Breathe Well group on IG, right there. That's what it was. And I didn't put the Breathe Well group. I just put Breathe Well group and she didn't pull up. I forgot that there she is. Here she is, Chelsea Madison, guys. She is incredible. I am so excited she's joining us. And I also have the mentors for Myo Circle. Myo Circle is going to be so good next year. And I'm telling you, if you want to do Myo Circle, this is your last chance. Do foundations now. Do foundations now so you can join us with Myo Circle. With Myo Circle, we're going to have an insane team. Insane. I'm so excited. No, why would you guys not release this patient? Her tongue is pretty tied. I want to know. I want to see why. You guys let us know. How is bingo going, by the way? Anybody almost there? Almost getting a line. If you get a line, you get either a free t-shirt or a free cup. Take a photo. I know I haven't said many of the words that are there, I think. Anybody want to say, why would you not release this patient? So this patient has sleep apnea. Suspect sleep apnea. The patient came to me without a sleep study, without a CBCT x-ray, just said, Renata, prepare her for tongue tie release. I'm like, hold on. It's not that simple. It's not just, let's do these exercises before you release because you need them. I feel like a lot of dentists don't really grasp the concept of what we do. And it's not just the exercises to get you ready for the release. So she's narrow and she has tongue volume. This is so interesting, Yasmin, that you said tongue volume. I started talking about tongue volume a couple years ago, and I said, nobody's talking about tongue volume. And you just mentioned that. Thank you. Everybody talks about tongue space, but nobody talks about tongue volume. Thank you, Yasmin. Tongue space, definitely. I'm not sure what else you meant, Nikki. So she has overflow, not enough tongue space. Okay, so she has overflow of the tongue whenever she suctions. Gosh, there's so much going on. The tongue scalloping has big tongue volume, but also there was no CBCT and sleep study. How can you recommend somebody to get a tongue tie release without knowing what the structures look like inside and without a diagnostic test? Another reason why I would not release her is because she's overweight. Did you guys know that the first place you gain weight when you gain weight is on your tongue? So people's sleep are likely to get worse when they first start gaining weight. The sleep is affected right away because the tongue gains weight. So that is a patient that we need. And I mean, if you go to a sleep physician and somebody to be treated for sleep apnea, they're going to have to talk about weight. And it's so difficult for us to be able to bring this up for our patients, but it's necessary. We're healthcare professionals, and it's not just about these exercises that we do. There's so much more involved. You know, my gosh, I'm not going to go into everything, but look how powerful your tongue is. Look how much this tongue is moving. And it's funny if you see this MRI scan. So I think this tongue is going to swallow in a little bit so you can see how much it moves. There it goes. Look how the tongue goes. The front part of the tongue is up, and then the whole tongue connects to the palate and pushes everything back. If you're restricted, your tongue can't do that movement. Whenever the tongue is talking, also the front part of the tongue goes up to the incisive papilla or to the spot a lot. And then the back of the tongue, look how pretty. I love to see that swallow. It's so satisfying. Am I the only one? But every muscle is supposed to be able to move. And look at the soft palate and look at the uvula. How it's moving, when the tongue is moving. Look how it goes back. It's crazy. Crazy, crazy. So how about this tongue? Would you release this tongue? Who else? You guys are a little quiet today. We had like 90 people last time. I know it's close to the holidays. It's cold. But I'm glad I was able to do this with you guys. Does my tongue look fat? I love that. Sleep. By Dr. I think I know this doctor. Kazarian. What would you guys say? Would you release this tongue, guys? Yes or no? Help me out. I have a mint leaf. I'm drinking some hot tea with mint and cinnamon stick. Nobody's answering me if they would release this tongue. Yes, depending on the intermolar width. Yeah, the tongue looks pretty restricted. You can tell it's a pretty significant tie. So yeah, probably yes. However, that's what the tongue looked like before. And it's already been released twice. This would be, oh my gosh, is the third or fourth release? I think it would be the third release. Then the question is it better? The child does not want to go through another release. He has enough space. He had enough space. He's wearing braces. Things were a little bit too far back, I think, in my opinion. But look at this. This was first release. And then second release. It's getting better and better. But so much trauma every single time. I don't know if I have any more photos of him. Every single time I see that somebody has been already released twice, I always say no more. Wait. No, some people are just going to reattach. The question was, oh, wow, why so many releases? Not compliant on post-op? They were extremely compliant. They just kept reattaching. Reattachment is healing. Everybody's going to reattach. However, some people are super, super prone to scar tissue. And whenever you form scar tissue, that's when the tissue is going to pull back. That's whenever you're going to see a big issue after the release. But in this instance, I said no more releases. We did therapy for a while. Function looked fine. Child did not want to go through another release. So I think he's like 13, 14 maybe. I said, just wait. Maybe when he's an adult, he wants to go through it again. Then it's okay. But I wouldn't do another one. You know, I think it was within like 1 or 2 years that he did 2 already. I was like, no, wait. And he's tired of doing therapy. I mean, you know, it's a lot for a young child. This research is by my friend. It's a review article by Marielle Bussi and her friends. Is ankylosing associated with obstructive sleep apnea? So they grabbed a few research and they found out that 2 retrospective studies concluded that the untreated shortened lingual frenum at birth is associated with obstructive sleep apnea. A prospective study concluded that there was an improvement in speech and deglutition after lingual frenectomy, in addition to improved sleep. A retrospective cohort concluded that lingual frenuloplasty combined with myofunctional therapy is effective in the treatment of snoring and mouth breathing. So look how incredible this is. Look how incredible this field is. So many more research coming out. So whenever you do decide to go into this field, it's so important for you to have a community of supportive professionals who are around you, who can answer questions that you may have, because questions are going to come up. After you finish a course, do you just get a bye, see you later, good luck? Or do you actually have a group that you can fall on that once in a while is going to be nudging you and asking you, okay, how are you doing? Okay, what's your next step? What's your goal? Let's get up. Let's do it. It's not easy. Still symptoms. I mean, he has a restriction, but function is pretty good for what he has. Interesting. I wonder if he would have done CFT after release to help some of the fascia restriction, just throwing some stuff. I don't know if I'm right. I really do believe that these people who get release after release and they're still restricted, I really do think that it just has to do with their immune system. I think some people are just like that. And we're going to do a third release. Is it going to improve? I think it's going to improve about 20-25% if we do another release. But I just did not want to put him through anything more right now. He's already been through enough trauma on that tongue. Every single time you're going to have to go, the surgery there, it's a little bit of trauma that happens to those tissues. Let's just let it wait until, at least a year. Let it rest. My tongue looks completely different after a year and a half after my release. Completely different. So we don't have to rush. Oh my gosh, I had another patient, y'all, the other day. I wanted to kill the doctor. I hope they don't see this. So I was seeing this patient. I actually never saw her for like true therapy. She came to me from a different myofunctional therapist after she had already had, I think, her release done. I don't remember exactly. But she just wanted the release therapy. And it was like, I have my appointment in 2 days and I just need you to do some things right now. And it's like, come on, that's not really how we work. But since she was already doing myofunctional therapy with somebody else, I just made sure that she was ready. I can't remember how long it was, but it wasn't long. And then I did post-op therapy. She had a little bit of reattachment, but she was doing good. And then all of a sudden, it was like 3 or 4 months later, I get a call saying, Renata, I need to make another appointment for my post-op release. And I said, what? Oh, yes, I went to check in with the doctor. And they released me again. Guys, that was like not enough time after the first release. They released her again. I would have never recommended anything like that. And by the time she called me and she came to me, she had already had the release done. She hasn't gotten that much better, unfortunately. But it's so important for us to communicate with our providers. Even though these are great release providers, I don't know why this guy did this. How about photobiomodulation? Would that be helpful, Laura? I think so. I think it would help relax everything else. I actually what I recommended for him was serapeptase. So I did therapy for a while with serapeptase, and we did get a slight improvement. And just with therapy itself, even though we had already done therapy, when I did it, the movement and everything got way better, way more control over those muscles. And then I recommended Kenalog. Even though it had been, I think, about a year since his release, I said, let's go ahead and do Kenalog a few times before we do anything else. So they only did one session of Kenalog and they didn't notice a difference at all. The doctor had recommended 2 or 3 more sessions and they just decided not to do it anymore. But yeah, photobiomodulation, I'm not sure if there's anybody around them that has it. They're in Atlanta, if anybody knows somebody who does that. But that could help, I think. I know there's some, some cases are tough. It's not going to be all pretty and pink when people come to you. That's why we can't have a protocol in terms of always is exercise second, always is exercise third. Because Every case is going to be different. All right, we're getting to the end. How are you guys doing? Let's see. Case 3, 30-year-old male, normal ENT exam, BMI of 25, an athlete, AHI of 44, so severe SA, grade 4 TRMR, very, very restricted frenum, respiratory rate of 19. In this patient, what type of targeted myofunctional exercises would you implement? What do you guys think? So grade 4, there's not much they can do with grade 4. If they're extremely restricted, I usually don't wait long to do the release on these patients. However, this patient is in a different country, and it was very, very difficult for us to find somebody to do his release that would even speak to me. So they didn't talk to me. I sent them an email and everything, but they didn't answer. And they did the release without sutures. I don't like to work with anybody that doesn't do sutures, especially in an adult, because the wound is huge and that whole area is going to create scar. And that's what happened. He created so much scar tissue. However, you guys can obviously tell that it looks way better than the first photo. Just with therapy, we got a little bit of improvement, and then better improvement a month after release. And then from month 1 to 5, we did serrapeptase, and you can see that the whitish is going away slightly. However, he's still somewhat restricted. For this patient, I recommended the tongue tie release. He did also radio frequency of the turbinates, a DICE procedure. A DICE is drug-induced sleep endoscopy. Whenever they put you to sleep and they put a camera in your nose to find out what the airway is doing. Am I speaking too fast today for you guys? I feel like I'm running. They put a camera in your nose to find out exactly what's going on back there whenever you're asleep. And we recommended a mandibular advancement device. So he did the tongue tie release and a mandibular advancement device, and he stopped snoring. So he's sleeping so much better right now. Is he going to need some other surgery? Palatal expansion, another release? Probably, if you wanted to like go through all of the options to make sure his sleep was really, really good, but he's not willing to go through those. So that's all he was willing to do. So let's see. How do you objectively track progress, tools, metrics? Many myofunctional therapists see patients in person. A lot easier for you to have metrics because there are certain tools that you can use on the patients when you have the patient in front of you. But since I work mostly online, I use a lot of photography, as you guys can tell. Document with photography, with symptom checkers. To me, that's the best way right now to tell if patients are getting better. Could you share your structured protocol depending on DICE collapse patterns? No, that's super advanced. How do you rehabilitate his breathing hyperventilation pattern? So definitely the patient's respiratory rate is 19. You know, even if he's a nasal breather, he's still breathing incorrectly. So there are several breathing techniques that you can use on a patient. I love to start with humming. Breathe in through your nose and start humming lightly. Make sure you don't blow your nose before you start humming and blow all the air out. Very quietly humming. Most of my patients start humming at about 7 seconds. And then most are 7 seconds. And then they do, I've had a child, I think I shared this here before, to stop all his allergy medication and asthma medication when he got to 25 seconds of humming. And I have a friend who does like Ironman. And the first time that I asked him to hum, he hummed for 46 seconds. Isn't that crazy? So breathe in through your nose and slowly start humming. It's one of the best exercises you can do. And there's a lot of research behind humming and behind the benefits of nitric oxide release. It's anti-inflammatory, antiviral, antibacterial. This is what we were talking about earlier. The effectiveness of any training program encompasses the correct application of scientific principles in its organization, which depends on good control of variables such as intensity, volume, recovery, interval, and training frequency. So my question to you guys is, I'm assuming most of you have already taken a myofunctional therapy course here. How often are you asking your patients to do their exercises? If any of you is telling your patients to do the exercise for 2 minutes, you need to come take foundations with us. There's not enough, there's no measurement of intensity, volume, recovery, interval, or training frequency. There, come take it with us. That's not how we should be checking our patients. I'm not going to go through these. There's some good research there. I am not going to show you guys this. Oh my goodness, this is like course material. Let's get out of here. I have a bunch of course material here. Okay, here's my tongue tie release journey. I'm not going to go through my whole thing, but look at how different my tongue looks a year and a half after, besides instead of a month after. Pretty crazy, huh? Here, should I stop? I'm going to stop sharing for a minute so I can see what's coming next. Okay, good. There you go. So foundations, guys. But tell me over here, out of the 22 people that are here right now, tell me who is interested in taking foundations. We have a huge discount for somebody. You can get 50% off if you got the whole bingo card filled. If you got partial, let me know. Send me a picture. I signed up for January already. Welcome, Lindsay. Very excited. Have you gotten your box already? Your box, your manual. Guys, did you see the manual? It is absolutely incredible. No other course does something like this. Let me remove that for a minute. Okay, Lindsay, how do you like your manual since you've had it? You've seen it. There's room for you to write notes at the end of every module. If you start reading already, you'll love it. Yes, it's such good quality. Such good quality. I mean, it's a book that you're going to keep with you forever. That you're going to be able to go back to. But let me know. I am here to help you guys out. What is something that you really wish that you had in a course that you didn't have? What is something that you wish you would have in a course if you were to take another one? But if you haven't taken anything yet, let me know. Let me know if it's your first, if it's going to be your first. But I will talk to you guys a little bit about foundations now. So foundations is for dental hygienists, speech pathologists, occupational therapists, physical therapists, and any dentists or doctors who would like to learn more about myofunctional therapy. So it's a 12-week program. We open up the modules every week. So you take the modules by yourself. You have a week to complete them. And then you meet us again every Tuesday night at 8 p.m. Eastern for about an hour. And we will keep those recorded and added to the course if you can't be there live. We have students that their time zone is like 3 a.m. So they can't be there live on Tuesdays, but it's recorded and put on there. The good thing about our course is that we have a WhatsApp group. And in the WhatsApp group, you guys can, after watching the lives, you can go there and ask questions about the ones that you missed or add the questions before. And we'll make sure to mention, answer the questions in the live. But it's a really interactive group. You get to be friends with those people that are there. We're going to put you together with another student to do your evaluations. You have to do an evaluation on each other. That's also something different than that our course does that you don't do with another one. There's about 60 hours of content over 12 weeks. And then here are the modules. So we have a little intro to orofacial myofunctional disorders, head and neck anatomy review and research, Orofacial Myofunctional assessment protocols. What actually are the protocols out there? Which ones are validated? Why do we have the evaluation and Airway circle that we do? It's because we're pulling from these protocols that are actually the protocols that we should be following. This is something new. We offer all of your intakes, your templates and intake forms, all of them that you need for your practice. Everything is already done for you. There's a link with the form already done. All you got to do is just click on that link, change the colors, put your name on it, put your logo, and print it out. It's, my goodness, if you guys know, if you just started a practice, how long it takes for you to make every single one of those marketing materials, you're going to have everything there for you already. And then we go through the guidance call, which is also called a consultation or a welcome call the first time that you talk to the patient. And then module 6 is myofunctional therapy full evaluation. So we split our full evaluation into a clinical assessment, so everything that you see, and a functional assessment, chewing, swallowing, breathing, muscle movement, and tongue mobility. That's really how you're going to build your treatment plan, is after you do the functional assessment on a patient. And then we go through our myofunctional therapy exercises. I think we have 75 exercises on this course. Then we show you therapy sessions. So pretty much during this course, you're also going to shadow us. So you're going to see several videos of me seeing patients. How do I talk to the patients? What am I asking? How do I interact with the patients online? And so pretty much you're shadowing me in all of these cases. Then we go through therapy recommendations. What are the things that we already recommend to everybody? Like clean your nose, brush the tongue, brush the roof of the mouth. Those are simple things that every patient has to do. Making sure that there's an air purifier. You know, we talk about sleep hygiene. So don't drink caffeine after 12. Don't exercise 2 hours before bed. All of these things we're going to go through over here on therapy recommendations. Myofunctional therapy protocol. This is a protocol that I developed just for you guys with the phases. Very, very easy to understand how to treat these patients, to explain to the patients how you're going to treat them, to be able to get better case acceptance. And then we go heavy into oral ties and a little bit of sleep in this course. MyoCircle is going to be heavy on the why behind the exercises. So the course total is $26.99. However, we have a discount for everybody who is here. And the incredible Anne, our speechy, who is just a genius and brilliant when it comes to research and anything myofunctional therapy. She treats adults mainly, and speech anyways, and is amazing. Oh, we have bonuses. Look at this. Are these right, y'all? These are not the bonuses. These are wrong. You get these bonuses. Sleep disorder breathing, myofunctional therapist perspective. I don't know where these bonuses came from. I think they're from MyoMeets. So after you take MyoCircle, we have all these extra courses. After you take MyoCircle, we have a special study club for MyoCircle graduates called MyoMeets, and then you have extra courses that you have access to. But that's not on there. How long is the course? So 12 weeks plus 4 months. What is the time commitment? Each module ranges from 30 minutes to 4 hours. So then you have an additional 20 hours of live meetings. Those clinical assessment and functional, we're going to do that live. It's about 4 hours, and it's on a weekend, guys. So Saturday and Sunday at 10 a.m. Eastern for those dates. How long do I have to access the content? You have access forever for the course content. Forever. We never take it away. I have already taken an intro course. How is this one different? Will I benefit from foundations? Everyone in this field, like I always say, holds a piece of the puzzle. The advantage to our course is the supportive community that you will gain access to. This will also be the longest and most comprehensive course you will find. Plus the different mentors that we have in this course. Several different mentors. Here are the dates. Everybody always asks me about the dates. Will I have access to a supportive community of like-minded therapists through foundations of OMT? Yes, we have a private WhatsApp group just for our students. Feel free to message at any time because, like I said, there are people that are in crazy time zones, and you're going to be sleeping. Just mute it because you're going to get messages all over the place. But it's an incredible part of the course, and it's how we really, really learn. We offer a payment plan. It's 3 payments of $900. You can just click on that link right there. It's on the website under the questions on the bottom. So if you want to do the payment plan, just go ahead and click on that link inside these questions on the bottom of the page. So the live sessions are always at 8 p.m. They range from 1 to 2 hours. I always set 2 hours aside because I talk a lot, as you guys can tell. Saturdays and Sundays are at 10 a.m., about 4 hours. Those are the long days. I think that these dates are accurate because we just changed them. We have a welcome call January 6th. There they are. I'm just going to let you guys take a screenshot of that. Oh, and there's the 4 extra meetings. Are they here? Graduation, no. We have 4 extra meetings after this that are not here. But this is it. Oh my gosh, I did not know that this code was here. I'm not sure if this is working. I had not checked the slides for this lecture. It's still working. I am going to leave this here. I've never offered this low of a discount. It's usually $500. So since it's already showed up on the screen, I'm going to let it. But this is not supposed to be here. Alrighty, y'all. We actually only have a few spots left for this cohort. As soon as it fills up, we are closing the doors. We would love to have you guys join the Airway Circle family, the Airway Circle community, learn from different experts in the field. This is not just about me. The difference of Airway Circle is that it is a community of other. Let me see if there's anything else. I cannot believe this link is here. Look at this. These are links from different things. This is the Black Friday. I'm telling y'all, this was not supposed to be here. Let me stop this. All right. Well, we would love to have. Do you guys have any questions for me? Any questions? Renata, how is the course? Renata, can we see inside the course? Like anything you guys want to know, reach out to me. I am here. You guys can text me, reach out to me on social media. But we know what is out there. And there are incredible courses out there. Don't get me wrong. I've taken several of them. But we really created something that is a differential in this field. We want you to feel supported. We want you to feel seen. We want you to have a place where you say, these are my people. These are my girls. I can ask any question that I want here, and I'm not going to feel bad. I'm not going to be, feel ashamed because I don't know this yet. But you're going to have so many people from so many backgrounds in there, and they all help each other out. It's really the beauty of taking an Airway Circle course. It's really the community that comes with it. So if you're looking not only to become a myofunctional therapist or to become a better clinician, if you're looking for that supportive community, look no further. We would love to have you. Thank you, guys. I don't think we need to do a third case study. I think we covered everything here today. I would love to see you guys in January. Don't wait. I'm going to go and turn this. A great question. Hold on. I'm going to answer this, guys. Stay a little bit longer. There's a great question in the chat box. I am going to leave this discount code for a few more days since I showed it live. But the other bonuses that were not there, I'm going to let you guys. Oh, you also get 100 brochures to start your practice. I don't think I have them behind me here, but they are the Airway Circle brochures with what is myofunctional therapy. You staple your card to it, and you can start marketing your business whenever you finish the course, so you can start seeing patients. You get several things. You get an insane box from us. The box, Lindsay over here can tell you guys what's in a box. Take a picture, Lindsay, and post it and tag us, and I'll put in our stories. But you get a lot of goodies. You get a book. So somebody just asked, Christine just asked, do you offer the COM? Do you guys understand how the COM works, the COM? I'm actually supposed to have a little registered mark right after it. So COM, Certified Orofacial Myologist, is a certification. It's the gold standard certification that the IOM gives. The IOM is the International Association of Orofacial Myology. No other company or association can give you a certification like that. Why? Even Airway Circle, I actually have some letters that I did for us to start using after somebody has taken both foundations and MyoCircle, have finished our program. They can have this special letters after their name, but I haven't started using it yet because I'm really not sure if it's necessary. I think you're distinguished if you've taken both Airway Circle courses. That's important for people to know. However, if I am the one giving you the certification, which is not a certification, if I am the one giving you those letters and I am the one giving you the course, everybody else in the field says, well, it's not fair because you're going to pass everybody. So if you're a dental hygienist, the people who taught you how to be a dental hygienist and the people who gave you the exam for you to get your license were different people. So that's what this is. The COM is only given by the IAOM. However, the courses are taught by everybody else. Our course allows you to go get your COM. So taking this course allows you to go apply for the COM through the IAOM. And I highly, highly, highly recommend everybody doing that. I think it's the only way that we can really be protected. We have another association there that's fighting for us. You know, we don't have a federal board on myofunctional therapy yet. So all we have to fall back on is the IAOM and your other professional association that holds your license. So you are eligible to apply for the certification of orofacial myology through the IAOM after you finish foundations. However, you have to have finished cases. So you're not going to apply right away. You can start practicing without the certification. Anybody can practice right now because we don't have a federal board. But after you have a couple finished cases, then you can apply because you need to show those cases to the examiners to make sure that you know what you're doing, which I know you're going to know what you're doing if you took our course. We're going to hold your hand through it. And seriously, if you need any help with any of this process of this journey of becoming certified, of how do you start marketing? How do you talk to other professionals? I mean, we talk about way more than most people, most other courses talk about. So come join us. I'm serious. It is such a good course. I wish I had this whenever I was young. Whenever I first started, I was a lot younger. I first started myofunctional therapy. We really created something that's going to hold your hand through it and you're not going to feel alone. I hope to see you in January. Thank you, everybody. The code, I'm not sure what code that was, but I will put it on the screen one more time so you guys can take a screenshot or just click on it. I'm only going to leave it available. Let me see what day. Today's Tuesday until Friday, and I'm going to shut it off. So I hope to see you guys there. If you have any other questions, email me. It's renata@airwaycircle.com or reach out to me on social media. Love you guys. I hope I answered all of your questions. Have a wonderful Christmas, a Happy New Year, if you celebrate both of those. And we'll see you soon. Thank you. Thank you. Thank you for coming. Bye-bye.